Would you rather have the segments of your spine be in alignment and have no pressure or interference on the nervous system, or not? Would you rather have it misaligned, irritated, and affecting the brain-body communication? Which one would you rather? It's your choice. Now that's basic anatomy. And we've then got to look at, well, okay, we ran through some causes of how it could get misaligned and then why we don't look after it. So when was the last time you actually had an image of your spine? And I'm talking, it could just be a standing up, plain film, weight-bearing x-ray. When you actually had a look at the alignment and segments of your spine, have you actually ever had that assessed? Now you might know that your posture's a bit off. G'day, Dr. Tony here with another episode of Realms of Power. So today, my solo episode is about one of my favorite topics of all time, and that is the spine. And I had a client this morning and we were just chatting away and we talked about the question of why people don't look after their spine. So it seemed like quite a simple question, but let's delve into that today. And I want you to ask yourself the question, why are you not looking after your spine as good as you could? So most people know the spine is pretty important. And I want to cover some anatomy to start with, just to review for you the importance of this magnificent structure. So as a chiropractor for 26 years, this is not a chiropractic podcast. However, I will bring in some chiropractic concepts from all of my learnings. But let's look at your spine and what it actually is there for, what it does, and some of its anatomy. So I've got the spine over here behind me, and you can probably seen a model of it before. And really, it's broken down into 4 or 5 main areas. So let's start with the neck, which is called the cervical spine. And in the cervical spine, you have 7 vertebrae, C1 down through to C7. And C1, the one right at the very top, your whole head sits on C1 at the atlanto-occipital joint. Now, that joint is really where the brain connects with the spinal cord and sends all the messages from your brain through to your body, besides the 12 cranial nerves. And that would include, say, the optic nerve, the hearing nerves, and all of those other cranial nerves, the vagus nerve as well. But outside that, we have our spinal cord, which then branches down through our entire body, helping the messages go from the brain to the body and from the body to the brain. So the nervous system becomes completely protected by the spine. But if the spine was one solid bit of bone, unfortunately, we would have no way of moving. So in the cervical spine, that is so important because all of the initial messages from the brain have to go through the neck. And in a normal position, those 7 cervical vertebrae would form a curve. And that curve, looking at it from side on, is called a lordosis. And unfortunately now, so many people have lost their normal lordosis, and that means it's putting pressure, extra pressure on the spinal cord. So 7 is an interesting number too. There's 7 days in the week. There's 7 chakras. So many different things rely on the 7 number, and it just, whether it's a coincidence or not, we have 7 neck vertebrae. So the next sort of vertebra is our thoracic vertebra, and we have 12 thoracic vertebrae. Now they curve the other way, forming what we call a kyphosis, and that allows the expansion of our lungs and our heart in our chest cavity through having a normal kyphosis. Now you might have seen someone with an increased kyphosis for one of those big humps in their back, or someone with a military spine. They're so upright, but they have no kyphosis. It's dead straight. So a kyphosis is what we call a thoracic. And again, 12 is an interesting number. We have 12 months in the year, 12 hours in a day. So many times 12's repeated, maybe that's a coincidence as well. Now, our lumbar spine or lower back has 5 vertebrae, 5 lumbar vertebrae. And what that does is forms a similar curve to the neck called a lordosis. And in that, all of our lower back nerves travel out through the spinal cord. So the spinal cord itself usually ends at around L1, the first lumbar vertebra, and then it branches into what's called the cauda equina, which is like a horse's tail. And that then forms the sciatic nerve. Most people have heard of that, the femoral nerve, and all the other nerves in the lower half of the body. Then we have this sacrum, and the sacrum is the central point of our pelvis, where our ilium join onto our sacrum. And the sacrum has five semi-fused vertebrae, and then the coccyx or the tailbone has four, again, semi-fused vertebrae. All of those add up to 33, which once again is an interesting number. We use 33 in so many different principles. But that's some basic anatomy of the spine. Now, the spine has bony segments. Each one of those has a joint, and the joint articulates with the joint below and above. And so that allows movement in all these different ranges, which allows complex movement of our spine, but also protection of our spinal cord and attachment, of course, of all the muscles, which allow the foundation or core of our arms and legs to work off and create mobility in our life. So that is a very amazing bit of anatomy. And most animals out there with spines aren't on two legs, they're on four legs. So the weight and the distribution of forces through their spine also becomes quite different. We decided we'd go upright as humans, and we have this big brain. And so our anatomy is quite different from most other things with the spine. So let's look at the importance of the spine in terms of neurology. So if the spine was to get misaligned, now I just said if there, so if the spine was to get misaligned, and that could be through some of the obvious ones like bad posture, an accident, stress, repetitive dominant handed use on one side, so many different causes of misalignment. What will happen is the nervous system may be interfered with, as in the messages from your brain to your body. And in other words, I'll say a bit more expansive, the mind-body connection might be holding some interference, as in those messages to and from the brain won't be getting through as well as they could. Now, no one would really want that. I don't believe you would want to have interference from your mind-body connection or interference to your brain. Most average person would say, no, I would rather be in alignment and have my nerve system working well. So I'll go back to the question I started with. Why don't people look after their spine? Most people would want to say, I would want to be as healthy as I can be with what I've got to work with. And I'd want to trust that my body can heal itself. Now, you can't deny that if you're alive, the body, the intelligence, the wisdom of the body is trying to heal itself, to express itself at its highest capacity. So then wouldn't we want that working as good as it could be? Now, we don't really get taught that. We do get taught when we're growing up to look after our teeth, let's say, or we do get told about how important our nutrition is or our exercise. Now, whether we do that or not is a different question, which I'll come back to later in this podcast. However, we don't really get taught of the importance of the segments of the spine. Now, again, I'm a chiropractor, right? So I have a bias towards wanting that to be working well. But take chiropractic out of this discussion and just look at your own body and your own life. Would you rather have the segments of your spine be in alignment and have no pressure or interference on the nervous system, or not? Would you rather have it misaligned, irritated, and affecting the brain body communication? Which one would you rather? It's your choice. Now, that's basic anatomy. And we've then got to look at, well, okay, we ran through some causes of how it could get misaligned and then why we don't look after it. So, when was the last time you actually had an image of your spine? And I'm talking, it could just be a standing up, plain film, weight bearing x ray. When you actually had a look at the alignment and segments of your spine, have you actually ever had that assessed? Now, you might know that your posture's a bit off. A lot of people know their posture's down. But when did you really actually check it? The imaging we have now available is so amazing. It's so um, detailed compared to what it was even 50 years ago. And then, of course, there's advanced imaging like MRI, CT, functional imaging, ultrasound, all sorts of imaging that we have available to assess what our spine and nerve system's looking like. Now, the spine is a beautiful design, and we don't want to be in pain. So our body cleverly can compensate and find a position where we're not in pain. But we know if we're working at 100% or not. And oftentimes we just ignore those symptoms. We push them aside. We say, we'll deal with that later. But I'm asking you again, when was the last time you had your actual spinal joints properly assessed? And why wouldn't you want that? Would you want your spine segments to be in alignment or not? That is a deep question. And why wouldn't you want to look after your brain and body communication? Why? Is it laziness? Is it guilt? Is it not enough information? No one ever told me. Now, sometimes those things are external things. You're becoming reliant on someone else fixing you. And that's where I want to go into the word trust. Now, trust is such an important word when it comes to your health and vitality. Trust in your own body's ability to heal itself. So if I use a different example of a different bony segment, our arm, let's use our forearm here. And with our forearm, if this arm got broken, so my radius and my ulnar got snapped and was hanging down like this, well, obviously you'd want to go to the hospital and get that checked. And your body's going to try and heal itself. But what if it tries to heal itself, but it's still out of alignment? Is it going to heal properly? No. So you're going to need the medical specialists and orthopedic guys up there at the hospital to make sure after they've x-rayed and analyzed that it's out of alignment, that it needs to be put in alignment and maybe need some support, some casts, some pins, some surgery. But if that bone is in alignment, your then body's ability to heal itself is going to try and heal it way better than if it was out of alignment. The spine is the same. So if it is out of alignment, it's going to try and heal, but it's not going to heal as well as if it's in alignment. Do you trust that message? Does that resonate with you on some level? So then why wouldn't you want your spine in alignment? Is it because you don't know? Is it because you haven't assessed it? Is it there's other priorities because your body's so good at compensating and you go, I feel okay, but I'm just going to leave it. I feel okay because I've taken some pills and numbed it out. I've got to be strong. I don't have enough money. I've got to do whatever other reasons you've got to do to keep the spine in alignment. Now, you could be looking after it yourself way better if you had that in the forefront of your mind. If your brain and body was communicating at its best, do you think it's possible that you could be working better? That you could be trusting your own body's ability to heal itself even better? Why wouldn't you want that? So, in realms of power, we're talking about how to be really authentic, how to do more of what you love doing, how to create or have ultimate freedom in your life, and how to never work again, ideally. Wouldn't that be great? So if we just look at those things, if you're being more authentic, being is such an important word because it's not something down the track, it's literally in the present. How can you be true or authentic to who you are? And what does that even mean anyway? What it means is being the real you and expressing yourself at your highest potential. Now, doing more of what you love doing, could you do more of what you love doing if you were in alignment? Now, we all get older, we all get more tired, we get beat up through life. But if we're in alignment and expressing ourselves through our spine at our highest potential, could you do more of what you love doing even better? I'm sure you could. So We looked at the alignment and the segments of your spine. Is it because we're judging chiropractors? Is it because we're thinking we should be okay, we should be able to heal ourselves? Well, there's a couple other points to the spine that's really interesting. Yeah. If you look at any other joint in the body, your elbow, your wrist, your knees, you have conscious control of those joints. As in, you can decide how far you want your knee bent or straight because you have conscious control of those muscles. But in the spinal segments, if I used an example of, say, the neck vertebra, C3 versus C4, if C3 is stark and irritated, can you move C3 compared to C4 yourself? Well, the answer is no. You don't have conscious control of individual joints. You can certainly turn your neck to the left, you can isolate it to a degree, but you do not have conscious control of your spinal segments compared to, say, your joints, your peripheral joints. So that then becomes one of the tricks. How do we get our individual spinal segments moving in alignment and strong if we don't have conscious control over them? It still comes back to the priority question at the start. Have you actually assessed your spine? Have you got an image of it? Where is it? Where is each joint relationship to the other joint? Have you assessed it? Can you even assess it? So as a chiropractor, I've trained for 5 years at university. I've now had 26 years of experience. And I can just put my hand straight on someone's spine and go, wow, that one does not feel good. As soon as I touch it, they're like, how did you know? I'm like, well, that's what I do all day, every day. I feel for the individual segments of the spine. And of course, that leads people to backache, headache, all of the symptoms, all of the loss of function. However, they haven't really still asked the question, why? Why have I not looked after the segments of my spine? Maybe you, as the listener, can ask yourself that question. And it's a really deep, profound question because now we're going to go out of the physical. We're going to go into the more etheric and spiritual part of our body and the trust of our body and mind body connection. Now, most people, when you hear the word mind body connection, think, oh, is that a bit woo woo? Is that a bit out there? What even is the mind body connection? And if you think of the word intuition, so you know how sometimes you get a gut feel, an intuitive sense that something's not right, that something doesn't feel true, that you don't trust that thing's going to happen, or you've held back on some level because maybe you've been hurt before, maybe something's happened, you haven't felt safe. So you've used a coping mechanism in your body, and through not allowing yourself to learn from that mistake and step forward into it, you're holding something in your body field. And we've talked before in the realms of power about our toroidal field and how the interaction of our mind and body and field relate to how we're holding tension or misalignment in our body. And one of the biggest causes I've found as a chiropractor for this many years is not just purely physical. It's most people would agree. I'll use an example. If someone's got anxiety, they'll generally feel it in some part of their body. It could be their chest tightness. They're all, and if they've got anxiety, their shortness of breath, they might be holding their posture or alignment a bit differently. And that anxiety is held in the body. Now, I could be aligning and adjusting that person at my table and helping and realigning. But if they've still got the anxiety because of a situation or an old trust, me adjusting that person for a very long time because they're not clearing the underlying cause. We haven't shone a light on what is the actual cause of that person's misalignment. And again, they haven't even asked the question, why have I not looked after my spine? How is my spine? I haven't looked at it on an x-ray. So they take pills, they avoid the issue, but they haven't really connected their mind and their body, that intuition and that connection to their body field. So again, I ask you to ask yourself the question, how is my intuition and my gut feel on something? How dialed in am I on the connection of the mind and the body? And if you're out of alignment somewhere, that intuition won't be as good. It won't be as connected. Now, I can do simple muscle tests to say, hey, that person's out of alignment and their arm is weak or their leg is weak because their brain's not getting the message down. I can realign them and I can constantly see that that strength may improve. Now, how long that lasts, that depends on the misalignment. And there's kinesiologists out there who do a lot of testing on the body field and sort of work out that connection coming from an old trauma or something held in their field needs to be cleared. Otherwise, their body is still out of alignment on a more, I'll call it spiritual or etheric level. And they weren't aware that that tension was being held in their body. So, back to the example of anxiety. So, we would all agree, most people would agree that some of the emotions can be held in our body. So let's look at some of the other emotions. What about a deeper emotion, something like guilt? And I'll use guilt because it's a classic one in health. I should do more exercise. I should eat better. I should go to the chiropractor more. I should brush my teeth and floss better between dental visits. And so many people know what they should do and then don't do it. So they end up feeling guilty on some level. They procrastinated, they were lazy, they put it off, they didn't have the finances, they didn't have the time because they had to look after their kids more than them. But I think most people agree that our health is so important. So I'm asking you today to really consider the importance of the spine. We did the anatomy before. We just touched on some of the anatomy of this magnificent structure that really is the core of you. And in realms of power, how to turn your power on after being more authentic, doing more of what you love doing, is having ultimate freedom. And ultimate freedom, if you've got all the financial freedom in the world, but you don't have your health and you can't move, not as good. So freedom comes under the topic of freedom of movement, freedom of not being in a health crisis or having no pain, and doing the stuff you want to do because you have the freedom in your body to do it. And that comes through your nervous system. So I want you to take something from this workshop today, this podcast today. I want you to take that the power is within you. And if your spine is not getting the attention it deserves, then maybe put that higher on your priority. Look at how can I improve my spine and nerve system? There are so many simple ways. There is basic stretches. There is posture work. There is breathing work and breath work to just visualize your spine being in more alignment. Because giving it more attention, if you reveal it, you can heal it. So shining a light or focusing on where is your spinal alignment up to now, and how much is that really impacting your quality and quantity of life? If your head is stooped forward, and that's so common these days with the phones, the computers, the posture that we all have, slumping forward. And if that's pulling on the brain and spinal cord, how much is that affecting your potential? Is that losing your potential in this realm? Is that stopping your ability to express yourself at the highest level and stopping your healing? So by just focusing on being more upright and getting your spinal segments checked and in alignment. And look, some people might be listening to this anywhere around the world. You don't have to come and see me as the chiropractor, but certainly finding a good chiropractor, because there's some chiros that really truthfully maybe aren't as good as others for you. So it's finding that right chiropractor to check and assess the segments of your spine, having a look at it with an x-ray, really doing a review of what you're doing that could be irritating your spine. And it could be purely physical. It could be that you just sit with a crap posture. It could be that you get stressed and you hold your tension up in your neck. It could be that your bed's off. So those simple ones, hey, they're probably easier to fix. And then getting a specific segmental adjustment from a really good chiropractor can so often restore that optimal function within. So it's like a link, it's a loop to optimizing your brain function by shining a light on your spine and giving it more attention. Why wouldn't you want that? Most people would. But then the perception of chiropractic and the fear around going to the chiropractor is incredible still. So take chiropractic out of this discussion and really just look at, would you want your spinal segments to be in alignment or out of alignment? Would you want your spinal segments, every individual segment, moving well or stiff and stuck? And would you want your spinal segments to be strong and stable or weak and unstable? If you can get those three right on a physical level, then your potential has gone up and up and up, and your power can be turned on. Realms of Power, remember, is about turning your power on. So you have to look at the segments of the spine for that and doing things you can do, breathing, breathwork, grounding out in nature, moving well, stretching, drinking enough water, like oxygenating your cells. All of the things will help restore the alignment of your spine. But until you've had a real good look at it, you don't really know. You might feel okay, but does that mean the lordosis is perfect? You might feel okay, but does that mean you don't have any degenerative segments? On a different level, how many people have had a heart attack because their artery was blocked right off and they didn't know about it because they hadn't imaged it or assessed it? So if you haven't imaged or assessed your spine properly and you want to turn your power on, this might be the episode for you to take some action. Actually go and do something about it. Now, in Realms of Power, we just ran our seminar retreat a few weeks back, and what a beautiful change we had for people because we were dealing with the underlying cause of why people on that emotional level might be having a blockage that's still manifesting in their body. And we're going to be ongoing running Turn Your Power On workshops, small 1 to 2 hour workshops. I've got some coming up in my clinic or online. And we'd love you to experience how turning your power on can make a massive difference in your life. So if that's something of interest to you, please check out our Realms of Power Facebook page for upcoming events. Or you can, if you're local here on the Sunshine Coast, you can come down to our clinic and do a live in-person workshop or a retreat. Our next retreat's down in November. We'd love to have you on board for that. So I want to wrap up this episode with some final wisdom. And the final wisdom for you today is really comes down to power and trusting your body to heal itself. But to do that, you need to know the true position of the joints and take responsibility that it's not an outside in approach. It's you making that decision. You making the decision to look after your spine, not when you're in pain, not when you're just restricted, not when there's a problem, but look after your spine and the payoff will be huge, both in the short and the long term. Trust yourself, if this resonates with you, to take some action today. So thanks again for my listeners for tuning in. I hope you have an awesome day. See ya.